in a strange and unusual time in all the world and hockey as well. We typically do this conference in May in person in St. Louis Park, and then we were going to do it in Mankato as well. Obviously, things changed, and now here we are nearing the start of the season and doing this virtually. But it feels good to say that we're close to the season, and I hope all of you are excited. And although there's some difficulties with everything, we're excited about the year and hoping that all goes according to plan. So with that, I just wanted to do a few things off the bat. First, to remind everybody that there's another session later tonight to go over state and national resources for growing hockey in Minnesota. And then every Tuesday and Thursday, with the exception of Labor Day week, we're going to host 2 more sessions. So you can, if you haven't seen the schedule, that's the schedule up there right in front of you. So obviously we don't require that you attend all of them, but if there are certain ones in there that resonate with you or a member of your association board, they are open to anybody. So encourage everyone to get signed up for those and attend those. Hopefully they're informative and get you going on the right foot for the season, whatever your role is within your association. So you can register at that website at the bottom, minnesotahockey.org/leaders. And we encourage you to do that. It's unlimited how many people we can have signed up. So would encourage you to do that. And then the last thing I want to do before we get started is thank our partners who have supported this event, really done a lot to make this possible over the years, including this year. So, and a lot of these partners that are attached to this event really provide services directly to associations. So USA Hockey IntelliGym, Tria Orthopedic, FlipGive, which is a new partner that specializes in fundraising. They're actually going to be a part of our fundraising session coming up. JLG Architects, which specializes in building arenas, will be part of another session. And I know a lot of people within associations are looking at upgrades or renovations or new arenas in their areas. So encourage you to check them out. We also have NBC Sports Engine, Viking Trophies, Dick's Sporting Goods, and Rink Systems. So thank you to all of them for making this possible, and we hope that our associations can utilize any and all of these partners when they can. So with that, we'll get started on our first session, which is Return to Play. And I'll start off by introducing myself. I'm Glenn Andreessen, the Executive Director of Minnesota Hockey. I'll be joined and partnering with our President of Minnesota Hockey, Steve Oloheiser, on this session. We also have a District Director representing all of our District Directors in the state. His name is Jeremy Reed. He's the District Director in District 4. He'll be available for questions that are specific to things that districts will decide going forward for the season. And then Lindsay Holst, who I will turn it over to here in just a little bit, we'll be going over our quick check-in process, which is really an exciting thing to do that we're hoping associations can get on board with leading up to the season here. So just a quick summary of where we've been. This session is really to go over our return to play guidelines, which we've continually updated since May. Each time that we've released our document, whether it's phase 1, phase 2, or now phase 3, we've hosted a webinar for association presidents and association representatives to chime in, hear from us on how we got to where we are, and then ask questions. And I said in those sessions that we don't have all the answers to all the questions. And I would say that's still somewhat true, but I would say we also have a lot more answers than we did before. And so we feel good about where we're at. This whole process has involved a lot of other groups. It's not just those of us within Minnesota Hockey. We've worked with the Minnesota Ice Arena Managers Association, MIAMA, the Minnesota Amateur Sports Commission, We worked with the governor's office and in particular Commissioner Tomes, who has been a fantastic resource in helping us get hockey back on the ice, and many others who have really helped us along the way, including equipment partners and association presidents and our district directors. So a lot has gone into this. These guidelines that we're putting forth, they're not, I assure you, they're not another way for us to make rules to make people follow. They are a way for us to get hockey back, keep our kids and our coaches and our volunteers safe. And if adhered to, it might not be perfect, but it's our best chance at doing the right things and keeping hockey going throughout the season. So we'll get into the document itself, but really this is about answering questions, and we'll give you guys an opportunity to do that through the chat. If you submit those will be brought to us. But what I first want to do is talk about or give Lindsay Holst the opportunity to talk about one thing in particular in our document, and it's on page 2, number 2, under the section called Arriving at the Rink. And it talks about associations using the quick entry check-in or the check-in and tracking protocol. And this is something that Lindsay really started and introduced to our Tier 1 leagues for each team and each division of Tier 1 to be using, and it's worked incredibly well in terms of a check-in as well as a tracking system for players in the age of COVID. So I'm going to turn it over to Lindsay. Lindsay, if you wouldn't mind just sharing a little bit about who you are and what you do, and then Lindsay can take about 15 minutes to walk you through the process of what this check-in process does.
Thanks, Glenn. My name's Lindsay Holst. I am a girls Tier 1 14U assistant coach and GM up here in Duluth, so District 11-12. I'm also an assistant coach for the Duluth girls high school team up here. So I spend a lot of time at the rink between those two teams and programs. So I'm really excited. This was something I kind of got off the ground up here in Duluth to help get us in the arenas a little bit quicker, not waste any ice time, because we were feeling pretty lucky to have the opportunity to get on the ice this summer. So I wanted to make it easier and wanted to keep playing. So I'll show my screen so I can kind of walk you all through this. Okay, so the nice thing about this process and what it is it's basically all built out of Google. So the bonus of that is Google's free. If you have a Google account, there's no cost involved. So this is a really good opportunity to not have to pay for a service. And this also follows MDH guidelines for contact tracing, and also follows their symptom checklist that they have. It gathers individual player, spectator, volunteers, refs, information as they enter the arena that can then be passed on to MDH if there was a potential exposure in the arena from anybody there. So like I said, really super easy way to start is through Google, having a Google account. So I'm just going to walk you through what I do. Google Forms. This is kind of the base of this process. This is where all the data is entered. So once you go to Google Forms, you're going to create a blank form, and it'll open up to this. There's lots of different opportunities to customize them to your specific association or your specific team, however you wanted to do that, but this is the foundation of it. You can change the titles. So for example, it gives you an opportunity to give directions, and then this is where you want to enter in all your questions or where you want the data to be gathered. For Minnesota Department of Health contact tracing, it's simple. First name, last name, address, and telephone number. Once you create a question, you always want to make sure that you hit required. Hitting required makes it so that it ensures that all the information entered in the form is submitted once someone completes the questionnaire. You can change how much information you want to gather. And then once you're ready to kind of build it out, super simple, you click the question or the plus sign on the side there, it drops down to where you want the last name. Again, you can customize them, want to make sure you hit required, and so forth. I always like to make sure that they're broken down into sections because then it's a little bit cleaner. People don't rush through it, kind of slows kids down a bit. Sometimes kids have a tendency to rush through a form. They just want to get on with it, get on the ice. So this slows them down a little bit. This is where I always then jump into symptom checklist. Again, this is something that the Minnesota Department of Health created, not something that I created. Easily found. If they make any updates or changes to any symptoms, you can easily reference back to that and make any changes to your form. Again, following that same process, adding that plus symbol. The number one question they always ask is a fever, 104 or higher. And this is where you want to switch how you're gathering the information, whether it's multiple choice or a checkbox. Either does the same purpose. And this is a simple yes and a simple no. Again, making that required. I won't go through all of that tonight, but I do have an example that I can kind of show you what it looks like after you build it out. So now you should see the Voyagers logo on the top. This is the girls District 11, 12, 14U team. And this is something that we use consistently for every dry land practice game. Regardless of the arena, we follow the same protocol because I know some arenas across the state are a little bit different, but we follow the same protocol every time. So you'll see it goes first name, last name, all of that information. I like to include city and state because we are getting some teams traveling from out of state, so it's important to know exactly where people are coming from. This brings us to the health screening checklist, just like I talked about. Again, everything on this health screening checklist I pull from the Minnesota Department of Health. So that's what the form looks like in its completion. What your players or your families would see is this. So this is what a completed form or a form that a player would see on their phone. And these forms this process is compatible between Android and iPhone. It works on both platforms. So to kind of show you what it looks like once a player were to submit the information, I'll enter in. Oop. The other thing I actually recently learned from one of my athletes is that you have an opportunity to essentially save your name, your address, your phone number, and it will auto-populate on a form. So that's really helpful. Obviously, you want to make sure they're actually answering the questions when it comes to symptoms, but that might be a little bit of a time saver. So once you hit submit, it'll show that your response has been recorded. And then as a coach, if you jump back to the screen, what we would see as the owner of the form, you'll see on the top that responses shows that there's one response submitted. This is where you'll have a breakdown. You can break it down by a summary of all the questions, specific questions you're looking for an answer to, or an individual submission. So that's a quick way where all the data is saved from day to day. The easier place to gather the information or to check it or reference it is if you hit this green square, it's going to open an Excel sheet. And this Excel sheet will show that I submitted a form as well yesterday and then again today. And it's date and time stamped on the side. And that will be a running document. This information is gathered every day, as many times as you need to. Multiple players can be filling out a form all at the same time. They can all scan it within seconds of each other and be working on it. So there's no delay or no backlog and waiting for someone else to finish their form. This is basically Excel. And it's easy to customize how you want, create it how you want. But again, this is a running document. It would be one place where all the data is saved based on the submissions from your form specifically. So from there, now it's the question of how do you get the code? The QR code is, again, another bonus of this is it's free. There's lots of different free websites available. I essentially found it through Google. So everything on this form is built off of a URL link or a link to the form. So if you were to want to send it to an individual player, you could, or a family member, you could, but the code is the best way to gather the information. So let me go back. So what I did is if you hit send, you're going to want to generate a link. So this is the link to the form. And you're going to want to copy that link. So again, that's form specific. And then you're going to want to find a website that, again, is your preference. This is the website that I use most often. There's no account necessary. It's free. You can make unlimited codes. So you take that code that you just copied, you're going to paste it into that section, and then you want to create your specific QR code. So that is your code. You hit download, and you will then generate access to this code specific that will only link to that Google form that we just looked at. From there, you can do a variety of things. You can print this specifically and have it with you, and players and parents can scan it from a piece of paper. They can scan it from your cell phone. They can scan it from an iPad. That's another bonus, is this can go electronic to electronic. Let's say you forget your piece of paper in your other car that has the code on it. You can easily pull it up on a phone and get your athletes checked in that step. What I typically do, I create a one-page kind of printable, put it with my coaching binder. I always have my coaching binder wherever I am with whatever team I'm coaching at that time. And that way it's always with us. And if an assistant coach is there before me, I always give my assistant coaches one, too. That way we all have one and it's all linked to the specific code that we have. Again, this is just a quick and easy way to gather all the information, and it gets players in to the rink quicker. You're not wasting any time, but then too, you're also making sure that you have all the information you need if you ever needed it. And it keeps the athletes safe and following all the guidelines that we need to follow. I wasn't sure if anyone had any questions. I'd be happy to answer them. Otherwise, Glenn, if you want.
Yeah. So first off, I'll say, Lindsay, you've already put together a video, a YouTube video that we'll post on our Minnesota Hockey YouTube channel. And Derek Ricky will be sharing that with everyone on here. But Lindsay kind of walks you through this. So if you didn't get all this right now, you can walk through that video, and that'll make it simple. But yeah, Lindsay, there were some questions that came in.
Okay.
That I'll just ask from the chat. One person said, "Did I see you ask for their actual temperature? Does that violate HIPAA?"
So my understanding is that we're not releasing any of the information. Technically, it would be protected health information. A temperature would be covered under HIPAA guidelines, so you wouldn't be able to release that to anyone. You would want to make sure that only certain people have access to where the data is kept. And with Google, they are secure to the point that no one, the Excel spreadsheet, no one has access to that except who created it. So again, temperatures have been kind of varying. It's mostly based on arena, I've learned. And for me, coaching high school hockey, it was school district. So that's where that got included. Obviously, if that's not something that your association wants to gather, you certainly don't have to, or you don't have to mark it down. It's something that you can easily take out if needed. And really quick, I can show you how to remove a question. So if, let's say, you had this form and you realize we don't need to gather that anymore, it's really simple. You click on it, there's a little trash can, and it's removed. And you wouldn't have to redo anything. It automatically saves in Drive. So even if you decided halfway through your team you didn't want to gather that information anymore, or you realized you were missing something, you can easily take it out and continue on.
And that information really isn't necessary, the actual temperature. It's just a question of whether they have a fever or have had a fever, correct? By the screening.
Correct. So on the Minnesota Health Screening Checklist, it asks if you've had a fever of 104 or higher. Again, the reason the temperature question was on there is because that's what our arena up here in Duluth has required. So that was something we gathered all summer. Again, don't have to have it on there though.
All right.
And you do this before each game or practice, Lindsay, with the tier ones?
Yeah. So what we always ask is, in a lot of arenas have said, don't arrive more than 20 minutes early, because you can typically get in about 10, 15 minutes, depending on the rink, ahead of your scheduled ice time. We have always asked our tier 1 girls to arrive at least 30 minutes early, at least, sometimes 45. We always hope for nice weather so we can socially distance in the parking lot, get a quick warm up in, but also get this check-in process done. The girls learn really quickly. All of the girls that I've interacted with this summer, they all pick it up pretty quick. They kind of know the drill. And then every day they're just kind of looking to, where do I do my form? And then we move on. So it goes pretty quick after the first couple of trials.
So Lindsay, another question that came in related to that is, Kristen asked, do players fill this out when they arrive at the rink, or do parents complete beforehand? Now, it sounds like your players are doing it when they arrive at the rink. But keep in mind that for our associations, they're dealing with players that are age 5, 6, 7, 8 and above. So not all have phones. So would you suggest parents do it when they arrive at the rink?
Yeah. Like Glenn said, I'm coaching high school athletes, 7th through 12th graders for the most part. So a lot of them have phones, but I've run into the occasional player that doesn't have a phone. And yeah, we've asked a parent to either do it, or we've ran into, using I've sanitized my phone really quick and let them use my phone. But for when you're looking at more of association kind of statewide, you are going to run into players that are 5. So I think it would be best for parents once they drop their kids off. That's part of their process.
Yeah, most certainly for, like squirt players and below, I think that would be
Yeah.
left to the parents to fill it out and
Mhm.
answer the questions so they're comfortable with what went out to the association.
Yeah,
Mhm.
and I don't think there'd be an issue, Lindsay, for them to fill it out at home before they come, would there?
No,
No, I mean, I haven't, we haven't encountered that. But I don't see why not. You're filling it out on the day you have practice. I think that's sufficient.
Okay. And then there was another question from Jay asking, what do you do with the info once completed? And if I'm correct, it really just sits there. And the purpose of that info is if there is an outbreak or a positive test, then that info can be accessed quickly and easily to find out which kids, which coaches were at the rink that day and were around that player that tested positive, correct?
Yeah, exactly. It's simply an information gathering so that if there, like Glenn just said, if there is an exposure and you need to report to the Minnesota Department of Health, who generates all of those contact tracing protocols, you would be easily able to look and say, okay, on August 24th, these are the teams that were on the ice, these are the coaches, the managers, volunteers, refs, whatever kind of practice or game you were having. And you can easily separate that information from the spreadsheet and get it to the Minnesota Department of Health without having to worry that you didn't have what they were looking for.
All right, a lot of questions coming in for Lindsay, so I'll try and rip through them here quick. But
Yeah.
One person asked, what are you doing if a player does not complete the form? Do you verify all team members completed prior to stepping on the ice?
Yes. So what I've done has varied. So with the high school age kids I was coaching this summer, we had almost 30 kids on the ice between the 2 different pods. So what I did was I had this spreadsheet up every practice, and I kind of would watch them kind of auto-populate and check in, and that helped when we were making our 2 different pods. We knew, okay, we've had 25, okay, we're on to the second pod, and we kind of were able to separate them outside the rink, keep them all together, and move on from there. So I always did. And then too, with our tier 1 program, again, I have 25 kids on the ice, and it's just making sure that they've all completed the form before we get in the arena. So I do watch it as it comes through. Obviously, that gets a little bit harder when you're talking about associations and potential regular season, what that would look like. I think it would be easier if it was one form per team, and then you have someone designated to kind of keep track of that for their practices.
Okay. Jeff asked under this item 2, arriving at the rink, states that association should use the Minnesota Symptom Screenings Guide, and these screens should be monitored. The language makes it sound as though the use of these screening guides are not required. Can you clarify? Jeff, you're right in that most of the things in here are guidelines, and we ask associations to follow them and do them, but many are not required. However, I guess I would just say, and Steve, you're free to chime in too. If things were to go sideways and there were issues, if the Department of Health or someone involved in youth sports at a higher level were to ask, was this done or was that done? It's certainly better if the answer can be yes. So I don't know, Steve, if you want to add on to that.
yeah, Glenn, that's absolutely true. I mean, Minnesota Hockey's worked extensively hard with varying groups to try to get the best possible guidelines and the best possible direction for our associations and for our teams. And the reason for that is, you know, we don't want to be responsible for hockey in Minnesota to be, or any youth sport to be canceled. You know, the board of directors, myself included, have pretty much committed that the season's going to go on in one form or another through Minnesota hockey, barring the state of Minnesota or somebody else stepping in and shutting it down. Now, you know, the associations have a liability and have a responsibility to help ensure that that happens. You know, rink managers are trying to do the best they can, and if our associations and our teams aren't going to follow the guidelines and aren't going to act responsibly, you know, city fathers may step in and say, hey, you know what, this is out of control, shut the rink down. We don't want this happening in our community, and, you know, shut the rink down. When we started in March, we had rinks shutting down all over the state of Minnesota. That, you know, the cities had, you know, the municipality that ran the rink made that decision. It wasn't even the state that made that decision. It was the local municipality. So we put these guidelines in place to, you know, try to ensure that we have the best possible methods to keep hockey going in Minnesota. And I'm hopeful that, you know, everybody understands that. You know, we're not saying it's totally 100% perfect. There's always questions, there's always changes, there's always things that, you know, what ifs. So, but right now, I think there's a lot of good minds have gone together to try to create the best possible options for us. So that's where I'm at.
Great, thank you. So I know there's more questions for Lindsay, but what we'll do now, that's kind of a good segue into the rest of our return to play guidelines. So we'll move on. Lindsay, if you're able to stick around, I know there are some more questions directed at you, but I think we want to get to all the questions. And so what we'll do is move on to the guidelines and try and answer the rest of the questions, because I think that's what the key part of this is to make sure we get to the questions that are on your mind. But going back to our document that we sent out last week, and it's no problem if you guys haven't had the chance to look at it closely. It doesn't go into effect until next week on September 1st. And it's pretty similar to our previous documents that we have released. A lot has stayed the same, but anything that's different, you can find in red font. And I'm just gonna go through a couple things here. Steve and I just talked about how these are guidelines, but there are a few things that we've changed in here that are required. And that includes the wearing of masks. For everybody in the rink has to be wearing masks, except for players and officials on the ice. So I was actually part of an arena manager's call today, and they had said that they've had some issues with parents who still are kind of saying they don't have to wear masks, or coaches who are on the bench saying they don't have to wear masks. They do. That's not a guideline. That's not they should be wearing masks. It is a mandate. So we ask that anyone in the rink help enforce that. Arena managers, I told them that they are in the right if they are requiring masks. It has to be done. So so that is something that is in these guidelines. That's not an ask, it's a requirement. You know, one of the other things that's been addressed in the guidelines is people in the facilities. We have added a piece in there because we do want to limit the number of people in the facility as much as possible. There are circumstances where a parent will need to be in there, especially for the young children on the ice. And there are circumstances where mom or dad is bringing their son or daughter to a game, and they've got little siblings that can't be left at home alone, other parents working, whatever it might be, that need to come in. So those are, you know, that's going to be allowed. Your kids aren't going to get kicked out, but whenever possible, try and limit how many people are coming into the rink. You know, not too much has changed throughout the rest of like the practices and tryouts. But what our season gets down to is games, and then tournaments and things like that. That's really what phase 3 is. It's our regular season. It's the season that we want to have as close to normal as possible, or as close to past seasons that we've had. So in these guidelines, you'll see some things where we're just trying to pound the point home of social distancing. If there's, try not to use locker rooms if you don't have to. If there's an ice resurfacing in between periods, try not to have kids cram into locker rooms, have them spread out behind the benches, wherever they can be. It does look different. It's not ideal. It's not the typical situation where we've had going to the intermission, the coach gets everyone huddled together, they do a pep talk. It might have to look a little different for the time being. Again, with the idea of keeping these kids on the ice. And then the last part of the guidelines is it's all red, and this is where we kind of wanted to address regulations across the state. And basically, what's been determined, it's a little bit like the school announcement from the government, where it was kind of put into the hands of counties and school districts to determine what's best for their area. And so a lot of this has been kind of put on the district directors to decide things like teams coming into the state, into their district from other areas of the country, from neighboring states, teams from within their district going outside the state or going outside their district for games. And I will open it up to Jeremy Reed from the district director perspective, because it may vary from district to district, but Jeremy and the district directors have been meeting continuously on this to kind of get on the same page as much as possible. So if Jeremy, you want to just touch on that process and where things kind of lie with that.
Yeah, thanks, Glenn. With anything, we have some questions too. We're actually working on a document for associations to use to kind of get an agreement from their out-of-state teams that want to come into their tournaments. The big thing is that we want them to follow the Minnesota hockey guidelines when they're here and participating in the tournament. So hopefully this will bring a little more cohesiveness between the district directors and the programs that value programs coming in from out of state to participate. There's a lot of things that are going to be new. We may not always get it right, but we'll have a lot of communication on things between the different directors to try to keep things as cohesive as possible moving forward into this year.
Thank you, Jeremy. I should have, I meant to do this at the start, but I'm going to turn it over to Steve Oleheiser too. Steve, before we get to questions from everyone, is there anything in particular you'd like to make sure we address off the top here?
Well, other than what I've said previously, like I said, the guidelines that we put together are to hopefully ensure that Minnesota hockey and hockey in Minnesota continues, through the whole season. I appreciate everybody's hard work and diligence and in ensuring that it does. We want to make sure that we offer the best and safest and prove that we are the best and safest at offering hockey in Minnesota, and that our guidelines and our processes are providing a safe environment, not only for the players, but for the parents and everybody and their families that are coming to the rink. We want to show to our parents too that they can be relieved that we're going forward and that we're providing that safe environment. I know there's a lot of parents that are probably questioning whether they actually want to have their child sign up for hockey and whether they actually want them to participate this year. So we want to try to make sure that, hey, we care and we're trying to do this the right way and show them the state of Minnesota. Like I said, we don't want to be the ones to be responsible for shutting it down and it going away. I'm committed that hockey in Minnesota will continue through the season as long as we can. We can't just shut down and not have it happen. We have a lot of rinks in the state that, depend on having the revenue. But there again, we have a lot of players and a lot of, parents and families that want to play hockey. For every one parent that comes to us and says, hey, what are you guys crazy? You shouldn't be playing hockey. We have 100 players and parents that come to us and say, thank you for doing what you're doing and keep it going. And we want to play hockey. So that's why we put these guidelines together. And I can't emphasize more that, try to follow and try to, adhere to them. And if you've got questions, absolutely send them to Glenn, myself, Derek, or, reach out to your district director so we can answer them and try to get the right process going and try to honor and help the arenas enforce, they're having a hard battle too. They need help too, to make sure that people come into the rink and know what's expected. So I encourage you to make sure that your people, that our associations and our people understand that, we're trying to be all in this for everybody. So that's where I'm at too.
All right, I'm going to try and get through some questions here. Any of the panelists can chime in on some of these too. So Kurt asked, and I'm going to kind of go from bottom to top, so I'm not skipping over anyone, hopefully. But Kurt asks, are there any requirements on how long someone stays home or quarantines if they test positive or have symptoms? Kurt, yes, there is. And those are provided by the Center for Disease Control and the Minnesota Department of Health. And I don't want to say exactly what that is because I always get my number of days confused. It's like 10 or 14 or whatever it is. Or 10 from when you get diagnosed or 10 from when you get, I can never keep it straight. So I'm just going to say refer to the CDC guidelines on that. But yes, there should be, those should be pretty laid out and clear on what those are. Anna Mueller asks, what are people doing / planning with players on benches during games? And then are people planning to quarantine a whole team if someone is positive after a game? At least on the bench question, Anna, that was talked about a lot on the Miami call. So we do ask for coaches to be responsible for the players on the bench, and we ask coaches to do the best that they can to ensure proper distancing, trying to keep kids spread out, try to utilize as much space on the bench or outside the bench if possible. So we're really kind of leaving it up to the coaches to monitor that. I know that's kind of an added burden on them when they're trying to watch the game and instruct the kids. But if they can do their best to keep kids spaced out, they can do things like have the backup goalie off the bench somewhere watching the game, but not next to everybody. Things like that can go a long way. I don't know that there's going to be a COVID police representative for Minnesota Hockey going and knocking on the coach's door if there's 2 or 3 kids standing next to each other on a bench. I mean, there's going to be some kids next to each other on the bench, but we do ask for coaches to be responsible and do the best they can with keeping kids separated as much as possible. And then again, on the question about quarantining a whole team, that is something that you should work with your local government on. If a positive test breaks out, they will advise you what you should do with the team and to how long they need to quarantine or if they need to quarantine at all.
Glenn?
Yes.
Glenn, on that one, correct me if I'm wrong, we just had that tier 1 team with the coach being tested positive. The team was entirely quarantined or told to shut down, and they had to report per our guidelines and per the Minnesota State. There's a process to go through to report that to the Minnesota Department of Health, who gives guidance as to what the processes will be in tracking and confirming how long that team has to stand down. Our guidelines call for 14 days, but correct?
Correct, exactly.
So that guidance will come from the Minnesota Department of Health once they report that.
Yep. Yeah, so please work with the Department of Health on any positive tests that come across. You know what, Jeremy, you might want to answer this one because it deals with teams from out of state, but this one in particular, what about teams from Thunder Bay or anywhere in Canada for that matter?
Right now, my understanding, Glenn, is teams from Canada right now it's not prohibited. That's my understanding of right now.
It is prohibited. It is prohibited, right? Isn't it, Jeremy? They can't come across.
Yeah, they can't. It is prohibited. They can't come across right now. I don't know if that'll change.
Yeah.
Change at all. So Canada's out. And then I'll just jump in on the second one that Anna had on there about people planning to quarantine a whole team if someone's positive after a game. One of the things that we've talked hard on directors about is when you get to your leagues, we understand that there's going to be some imbalance this year. There may be some teams, some games that or contests that you have canceled due to COVID, and that might they might not be able to fit the schedule to make up. So you may not get all your games in. They may be imbalanced, and directors are ready to work with that. And Tim, yeah, Canada is out right now. They are not allowed to come into the U.S.
And that's a border decision between United States and Canada. I mean, it's no unnecessary travels allowed between Canada and United States. We even have some associations that border the border up there that actually have players from Canada that play on that local association, and they're not allowed to come over until that is lifted from the state or the federal governments from Canada and United States that says that those players can come across the border.
One other question that came in, or I know there's been several questions about it, is coaches wearing masks. This one was talked about quite a bit amongst our group because as most of you probably know, masks are required for anyone except when they're doing strenuous physical activity, and hence why players are not required to wear them during practices or games, why officials are not required to wear them during games. Our guidelines currently call for coaches to be wearing them during practices. They must wear them during games when they're on the bench. And on practices, I know that might get some blowback. We are running Minnesota hockey clinics. All the coaches are required to wear them. They are wearing them and they haven't had an issue. Now, if a coach is doing strenuous activity, skating with the players, doing these high-level drills with them, I could probably see a scenario where, yes, you might want to lower your mask. But if the coaches are talking, standing there, giving instruction, passing pucks, whatever it might be, coaches should be wearing masks. And really, it's about just doing everything we can. We know it's inconvenient, but it is about doing everything we can to show that we're doing the right things in Minnesota hockey to keep hockey going and to limit the spread and to show that we're following guidelines as strictly as possible to keep kids on the ice. And Steve, I don't know, you were a part of those discussions. I don't know if you have anything else to add to that.
Not really. I think, Glenn, you covered it pretty good, but yeah, that's, I know in our tier one and our clinics and everything else that we're running through Minnesota hockey, all coaches are wearing their masks, and I have not heard of any, Lindsay's nodding her head yes. So, and in talking to our high performance people, our tier one people, I'm not hearing any blowback from grumbling from the coaches that they're not going to do this or anything else. And as Glenn said, I mean, everything we're doing is trying to keep the game alive. So, and coaches, I would assume that they're dedicated and they want to have this game keep going for the whole season. So a little bit of inconvenience for the time being may be something that we all have to put up with.
Thanks, Steve. I want to make sure I get to as many of these as possible. We've got about 8 minutes left. One person asked what are plans for arenas that don't belong to Miami. How can we ensure similar practice across the board? Would be a bummer if a rogue arena ruins it for all of us. I agree, but we also, one thing we're cognizant of is putting too much pressure on an arena or arena manager. And that's really part of why we want to have this discussion with you guys as leaders of your association. If you men and women are really helping to enforce these guidelines, that will go a long way. One of the things have gone well over the summer for the most part, and that's good. But we've heard stories of some arenas are really strict, some are loose, some teams are following everything, some are not. Our hope is that as teams fall under Minnesota hockey and their associations, they will adhere to these guidelines as close as possible, because there is kind of that oversight a little bit from the association to say, hey, if you're not doing this, if your kids are all showing up, in their street clothes and not, showing up fully dressed, and they're hanging out and they're doing things outside the rink in the arena and playing around, we need some people to kind of just step up and help enforce these things. I know people don't want to be the bad cops, but we also want to make sure people are following these, and we're confident that people will, because everyone that's putting their child in hockey this year is going to want to keep their child in hockey this year. So we're hopeful that having some the umbrella of Minnesota hockey and the associations can help with that. I just saw something pop up in the chat from Katie, and it's a great one, unrelated to all this, but shout out to East Grand Forks, who is up for one of the finalists for Kraft Hockeyville, and voting starts for that on Saturday at 6 a.m. Through Sunday, and it's unlimited voting. So please vote for our great association up there in Northwest Minnesota, East Grand Forks, for Kraft Hockeyville. So thanks, Katie, for the reminder on that. Jess, yeah, go ahead, Steve.
Well, it was just one thing I wanted to touch about on locker rooms, and typically we're telling players to show up. Well, we are telling players to show up dressed and everything else, and to be ready to go. And I've had some questions or had this conversation with a couple of arenas that their lobbies aren't big enough to accommodate a group or two groups of 25. You're talking 50 players being in the building ready to go on the ice. So they're utilizing locker rooms in a manner of a waiting room kind of thing, where players enter the locker room, get your skates on, but you sit on the benches socially distanced and with your masks on until it's time to go. And then when those players head out to the rink and the locker room is closed up, and the arena can go in and sanitize and clean it up. So that's allowable. People are, I don't want anybody to say, well, what the heck, that arena's using the locker room. Well, it's how are they using that locker room? And then another question was about masks and how the adult leagues. Well, I would expect that the adult leagues would have to adhere to the Minnesota state guideline as far as masks are concerned. Same as a player on the ice. Yeah, obviously you can have that mask off when you're an adult player on the ice, but when you enter that arena, you should have that mask on. It shouldn't be because you're an adult, I don't have to follow the guidelines set up for youth hockey. Well, it's a Minnesota state mandate for masks to be worn inside of a public building. So, that follows that they have to do that. And when they're coming off the ice, the same thing. I would imagine that for the most part, most of those adults should show up at the rink dressed and ready to go on, just like the youth do too. And don't expect to commingle and have a beer afterwards and sit around and bullshit, because, it's not a good situation. So.
Yeah, the locker room issue was brought up in the arena manager's call today too. And we specifically don't have much in our guidelines around locker rooms, because every arena is so different. Not every arena has the ability to just have kids all sit out in a common area and get their skates on. So sometimes locker rooms have to be used. But I think I can speak for Steve and Jeremy and others that we'd prefer that players not use the locker rooms if they don't have to, and coaches not use the locker room if they don't have to. I have a daughter who's 7. We are in Bloomington, and Bloomington Ice Garden, they have completely closed their locker rooms. They do have enough space for kids to get dressed, but I would say even if locker rooms were open, I would still want have my daughter come fully dressed, put her skates on a bench, in the lobby or in the stands, and then get on the ice. I don't need her crowded around kids in the locker room any more than is necessary. So I realize she's 7, and that could be different for a 12U coach that wants her team all in the locker room together. But social distance is key, and that's what you'll hear from leaders in the government, leaders of the Minnesota Amateur Sports Commission. Just distancing whenever possible is key to all this. So please keep that in mind.
Glenn, do you want to address this dry land question here that's on the, did you see that one?
Sure. Yeah, I'm not looking at the question. I did see that earlier. Our guidelines say to not do dry land, to continue with not doing dry land within the arena. We're trying, we understand the importance of dry land. We always encourage that. At least when the weather's nice, we would ask that you do dry land outside. I guess I would say if there's dry land activities that you can do socially distanced, that's fine, but it's limiting people inside the rink, inside the arena. So that's why we keep the guideline as not having dry land activities inside the arena. We hope we can get to a point where, this season where we can remove that from the guidelines. Maybe that's phase 4 as we continue to return to more normal. But that's kind of where things are at with dry land. We are at 1 minute to 8. Well, sorry, one last question. Jeff just chimed in. And Steve, maybe you can address this. Can you briefly discuss USA and Minnesota Hockey's general liability insurance and how it relates to any potential COVID claims against the association?
Well, I've been assured that as far as an officer director, we're covered under general liability directors and officers insurance, so that, should there become a problem that way. As far as, sickness and injury or sicknesses, I do not believe that currently there's any insurance out there right now that is covering that as far as USA Hockey is concerned. It's generally considered like a flu right now. It's not a broken bone, it's not a broken back, it's not a broken neck, or an injury of that sort. So I'll follow up more with our risk managers to find out, and maybe we can put something out on at the Minnesota Hockey website to clarify that too. So
okay, so we're at 8 o'clock. First off, I want to thank Lindsay, Steve, Jeremy for joining us tonight. I want to thank all of you for joining us tonight. A reminder that Lindsay's demo video will be shared with all of you by Derek Rickey, so look for that. Lindsay has also said that if there are questions, I know there are a lot of questions for Lindsay, so try not watch the video first before you bombard her inbox or her cell phone. But she said she is more than happy to take questions and help people through this if needed. So with that quick check-in process, please feel free to direct questions to her. And then lastly, any questions on the return to play that either I didn't get to or come up along the way, please contact us. There are still questions that we're trying to get our way through, get guidance on, and figure out. But we are moving full steam ahead for the season, and we hope that this helps helps everybody with that. And again, thank you for all that you're doing within your associations to get kids back on the ice. And we look forward to seeing you at the rinks, hopefully. So with that, we'll end. Appreciate it, and hopefully we'll see you in the next session here on growing the game in Minnesota and Minnesota hockey programs. Take care, everybody.